Physical abuse in custody is sometimes a part of the physical torture that is given to the prisoners during their interrogation. So it's sometimes a part of the interrogation, but it's quite inevitable for the police custodials to basically avoid this physical abuse. But sometimes it's quite necessary for the policemen to require this physical abuse. It can sometimes prove quite fatal for the prisoners. So one has to be quite careful, and there are quite bleak boundaries between the non-fatal and the fatal kind of the torture that these prisoners are subjected to usually. We are going to discuss this fatal physical abuse during the custodial period and how it can be basically evidenced through a normal investigation, how one can just calculate the time duration of the injuries, that were these injuries of some pre-custodial period, or were these injuries there during the custodial period through the interrogation that was carried out by the police officers. So it is a quite confusing state sometimes, and a forensic practitioner or a forensic expert, if he or she is carrying out an investigation on part of the prisoner who has been subjected to death during the custody through the physical abuse of the police officers. And obviously this physical abuse is of an illegal type, and the assailants or the victims relations can subject this physical abuse as of an illegal type. So an investigation is sometimes carried out in cases of the deaths of the prisoners, and it's a quite immaculate investigation because the police officers are involved on the other hand, and on the other hand, obviously it's an inhumane procedure. Human rights are sometimes violated during this interrogation, and so as a practitioner one has to be very careful carrying out these investigations of the deaths during the custodial periods. It can be of some due to some natural diseases that the prisoner was suffering from, and even the non-fatal injuries proved to be fatal for the prisoner. But of course, when someone has been taken into custody, the baseline investigations have been carried out, and it's a normal procedure to carry out these baseline investigations for the prisoner. So it is very important to carry out these baseline investigations, and if there is some sort of an abnormality and the person cannot bear this custodial interrogation torture, one should not be subjected according to the human rights. One should not be subjected to such torture that proves to be fatal for the person whose investigation or whose interrogation is being carried out. So one has to be very careful while doing this. Being a police officer, if you are carrying out an interrogation, you should be very careful what kind of a torture you can subject the prisoner to while the interrogation, because it's quite illegal and it's quite inhumane according to the WHO acts. Now, in this section, we'll be discussing the fatal physical abuse. So, physical abuse, as I've already mentioned, it can be of chemical type as well as of physical type, and it sometimes proved to be quite fatal for the prisoners. So, we are going to discuss what evidence should be collected to basically direct this abuse towards the fatality, and of course the time of injuries is being calculated, whether these injuries were of the pre-custodial period or during the custody. So the delayed examination is obviously sometimes a part and parcel of this investigation, and one has to be quite sure. The crux of this investigation is that one has to be quite sure that these injuries were sustained during the custodial period by the police officers, and one has to be quite evident, and one has to be quite sufficient during this investigation period. So now the evidence of the fatal physical abuse. How are we going to collect and how are we going to move forward during this investigation of any death that has been carried out during the custodial period? How it is going to be investigated? First of all, the autopsy appearances. Once you have the dead body at your hand, the dead body is no different from any other homicide, because there is another person who has tortured basically the victim, and he has been subjected to death. So you can find bruises, you can find lacerations, you can find blunt injuries, as well as you can find any signs of sharp weapon injuries as well. All of them, they're included in these kind of homicidal deaths that are basically the custodial deaths, and the homicide is being performed by the police officers. So this is basically the scenario that has to be clear in your mind. And then, of course, the asphyxiating conditions. For example, if it's the mugging phenomena, that the neck is being basically compressed between the elbow of the person who is committing the homicide. So there'll be all of the changes of the mugging phenomena. It will be an asphyxiating condition. The veins will be bloated, the face will be of a bluish discoloration. So all of these are basically the signs of the asphyxiation. Then there is an electrical torture. So all of these signs of the deaths by the electricity, even the high voltage electricity or the low voltage electricity, the spark burns, all of these can be present on the dead body. And it's basically any other homicide. It matches any other homicide at this level. Now, the confirmation of the lethal torture depends upon, it basically depends upon the circumstantial evidence, of course, and the other corroborative evidences. So you'll basically investigate the crime scene, the torture cell, of course, or the interrogative cell where the interrogation has been performed. You will look for signs of what kind of tools have been used over there at the torture cell that the person can be subjected to. For example, there can be any electrical tools that are used for the electrical torture. So that is going to be a base for the evidence at the circumstances. Then the head injuries are also very important. For example, shooting and suffocation, all of these are a part of the normal fatal physical abuse that is being carried out in the torture cell. It may show no variation from the same death modes, and that has to be basically kept in mind. Then the evidence of the fatal physical abuse. It's basically deaths can have political overtones over here. So it can be some sort of a political pressure, and deaths can be a part of this. One can basically, the police officers are under the political pressure to basically perform the death or perform the homicide of the person under interrogation. So one has to be very careful during this period. And this is basically the instances of the illegal death that are basically perpetrated by the military. So military can even be involved in the assassination of the deaths that have been designed for the prisoners. So it can also be a part of this military operations, or it can be a part of the political intentions. And then we can have the victims in detention of some form of custody. So it can even be a part of this custodial detention period, and one can be subjected to some sort of a fatal physical abuse. Fatal event may be different from the non-fatal event, and so the person beaten may be disposed of by shooting. So the non-judicial shooting is also one of the part of this physical abuse or the fatal physical abuse that is being carried out over here. Then we have the delayed examination, the long delay before being able to examine victim. So there is a long delay or a long gap for the delayed examination, and sometimes it can cause confusion for the person who is basically interpreting whether they were the custodial injuries or whether they were the non-custodial injuries. We have the people can be detained for months or years in the custody, and after this ill treatment, it can be a slow death for the people, and it's quite inhuman, of course. And then it can be exiled, or the victims can be in hiding, and it again can be basically cause the delay of the interrogation or the delay of the investigation by the forensic experts over here. Then we have the acute injuries, and some injuries are sometimes healed over there, the bruises are absorbed, and the wounds and burns are scarred over in these cases. But still, we have to investigate what time period the person has been there in the custody with the people and with the police officers, and what kind of torture they have been subjected to. So the long-term post-mortem changes are quite common in such delayed investigations. And in this section, basically, we dealt with the fatal physical abuse that sometimes the prisoners are subjected to, and how it can prove fatal, and what are the investigations, routine investigations that are carried out in such cases. That is the end to this section. Thank you for watching sqadia.com.